Joining us now is Republican Senator Bob Corker from Tennessee. Senator, good morning. It's good to see you.
Good morning, guys.
I know that you're not in favor of this. I guess the question is, will all the Democrats and the two independents allow this to come to the floor? Can they do it this weekend?
Well, I don't know. You know, under normal circumstances, I think it would take mind-altering drugs for that to occur. I do think there's something happening in this body right now as it relates to health care reform that is pretty odd. This bill, as proposed, our staff has been working on it most of the night. It has more trickery. It's a lower level, more sinister than even what happened in the House. It actually is $189 billion in the hole because $247 billion that is necessary to take care of the doc fix is not in this. They've added something that Kent Conrad, who's chairman, the Democratic chairman of the Budget Committee, has called a Ponzi scheme. It's called the Class Act. It's a new entitlement for long-term care. And what they're doing is taking premiums in now, premiums that they're going to pay out in the future, but they're counting those as a budget surplus in part of this bill. So I have to tell you, I actually thought that Senator Reid would try to put something forth that was more sensible. It looks like to me he's taking a big step back. I don't know what the moderate Democrats are going to do, but I do know that this bill is terrible for our country. When you look at Medicare, $460 billion coming out of Medicare, which is insolvent. Now they're adding a Medicare tax, which most people might think would be good to make Medicare, or some people might think would be good to make Medicare more solvent. Instead, it's not being used for Medicare, it's being used for a whole new entitlement. So we are throwing our country's future down the tube. This bill is terrible.
Senator, can they say to anyone that you know, like Nelson or Orlando, can they say, listen, this isn't the final bill. Let's at least get it so that we can debate it. Just let us get it to where we can fix some of these things that you don't like. Go with us so we can get 60 to bring it to the floor. And we'll get, and also we hear there's some, Larry says there may be some backroom things that go on. I don't know. I can't imagine. But will they get it to 60?
You know, I think there's a good chance they do. My guess is that has been the argument. Look, they're offering an empty shell, or a shell that is not controversial. That's the bill that will actually be voted on this weekend. And my guess is they may get there. I think what our side is trying to say is, look, this is the first threshold. We all know what's in this bill. We've seen it. It's 2,000 pages. We went through it all last night. What you're really doing is voting for this bill. Certainly Ben Nelson has argued that, look, give us a chance to amend it. My guess is on that argument, they may get 60. Obviously, the bigger vote will be ending debate. I want to see health care reform. I campaigned on health care reform. I think there are changes that need to take place, but we truly are spending our future away. This bill is terrible for our country. I think most people thought the two parties, and I think y'all have been talking about economics. Larry Lindsey's there, I know, who's focused on that all of his life. We are doing exactly the wrong thing and sending the wrong signals to our partners around the world that are funding our debt.
Senator, this is Mike Jackson. Good morning.
Hello, Mike.
Why don't we have more of a free enterprise solution where you let consumers buy health care insurance across state lines? I mean, it's massively inefficient to run health care state by state. And why don't we take away the federal antitrust exemption that the health care insurance industry has and do it the good old American way? Open it up to free competition and free enterprise.
Mike, that is what we have been arguing all the way through. There are several pragmatic steps we can take one at a time that would move us in that direction. The way that you've built your success in the auto industry, it's mind-boggling that we're not doing that. I've got a bill that is a very simple bill that would add coverage to 16 or 18 million Americans, would not add a penny to the federal deficit, does exactly those kind of things that you just talked about. And while we cannot discuss something like that on the Senate floor and get movement, especially among moderate Democrats that embrace many of the same principles you just talked about, to me is not understandable.
Senator, are you at all worried that a lot of the money here is actually being passed on to states and localities because of Medicaid, which cover half the costs?
Look, there's a huge unfunded mandate. In the House bill, there were $33 billion in unfunded mandates to states. It was going to cost the state of Tennessee $1.3 billion. This one has lessened that to $24 or $25 billion in unfunded mandates to states. But yes, this is another case of the federal government saying, look, this is going to be our policy, and by the way, states, you're going to pay for it. The other piece of this is that there's no question, as Mike was just alluding to competitive mechanisms, this bill is actually going to raise insurance rates for those that are in the private sector, because we have mandates telling people that they have to buy insurance that is different than what they already have. And so we're really making the private market more non-competitive, adding huge burdens to future generations, and to me, going exactly, again, in the wrong direction.
Senator, they keep making the point that it's never gotten this far before, and it has a momentum so that it's definitely going to get to its culmination. Is that your viewpoint, that it'll happen this year? If it didn't happen this year, do you think that next year we get too close to November and nothing happens? What do you really think is going to be the end game here?
You know, I think, look, you've got, intelligent people on this program, intelligent people listening to this program. My guess is, as we debate this 2,000-page bill over the next several weeks, there will be some Democrats who realize that, look, this is a terrible thing for us to do.
This is what you hope for, or what you think will happen?
I think I'm going to predict a 20% chance that we do not pass health care reform on the merits of the fact that this bill is terrible legislation. If I propose this bill, there's not a single Democrat that would vote for this bill. This is all about doing something for the president. I think at the end of the day, there's a 20% chance that at least enough Democrats will come to their senses, realize this is terrible for our country.
So that means there's an 80% chance.
I'm going to guess there's an 80% chance that something passes. I think it could be right after the first of the year. I don't think any of us on the Republican side are going to be concerned about Christmas holidays. We look at this as the most backward-stepping thing for our country that we have seen in decades, and we're going to do everything we can to keep a piece of bad legislation like this that will hurt our country for generations from happening.
All right, Senator Corker, thank you.
Thank you. Yes,
Happy New Year.
Thank you. Thank you.